Bree, how do you use the pediatric feeding disorder diagnostic codes? So glad you asked. Let's talk about it. First off, it's important to know all the codes. R63.31 is pediatric feeding disorder acute, meaning that the child has had feeding difficulties for under 3 months. R63.32 is pediatric feeding disorder chronic, meaning that the child's feeding difficulties have been present for more than 3 months. R13.10 is the dysphagia code not otherwise specified. R13.11 is dysphagia oral phase. R13.12 is dysphagia oral pharyngeal phase. R13.13 is dysphagia pharyngeal phase, and R13.14 is dysphagia pharyngeal esophageal phase. Now that you've got those down, typically I use the pediatric feeding disorder code as the primary diagnosis and then use the R13 codes as secondary if they're warranted. For example, if a child has been on thickened liquids for over 3 months, R63.32 and R13.13. Maybe R13.12 if there's also oral motor skills being impacted. Let's say there's a child with a G-tube who has an oral motor delay, R63.32 and R13.11. What about a 2-week-old infant who's having bottle feeding difficulties and is characterized by a weak, inefficient suck, swallow, breathe coordination? R63.31 and R13.11. I could go through so many other examples, but hopefully this is a helpful start in understanding how to use the pediatric feeding disorder codes.